In July of last year, the Federal Department of Health and Human Services, Centers for Medicare and Medicaid Services notified California that our current managed care organization tax is not compliant with federal rules. This placed $1.1 billion in federal funding in jeopardy. In January, Governor Brown floated the idea of an MCO tiered tax that was rejected by the industry and was not pursued. The MCO tax that I am proposing, along with 12 co-authors in AB 4, is needed because more than 9 million Californians receive their health care through Medi-Cal. More than 5 million children receive their health care through Medi-Cal, 5.2 million California kids. More than 200,000 developmentally disabled Californians are receiving vital services every day in California, and nearly 500,000 Californians are receiving in-home supportive services. These are critical services affecting the health and well-being and day-to-day quality of life for real Californians every day. However, these services are not inexpensive. Over the last few years, the cost of providing these services has increased. The demand for these services has increased, but the funding has been substantially reduced. This is unsustainable and cannot continue. Consequently, in June, Governor Brown called the legislature into extraordinary session to consider and act upon legislation necessary to enact permanent and sustainable funding from a new MCO tax or alternative funding source. As a member of the Public Health and Developmental Services Committee in the extraordinary session, I feel it is necessary that we move quickly and that we pass legislation before the legislature adjourns in 4 weeks. Therefore, I introduced AB 4 in the extraordinary session to create an MCO flat tax to generate the annual revenue needed for the following purposes: fully fund Medi-Cal, restore Medi-Cal rates, reinstate IHSS hours, and increase developmental services funding by at least 10%. AB 4 creates a flat MCO tax that will provide a stable stream of revenue to fund critical public programs. $1.1 billion in matching federal Medicaid funds, $226 million to fund a 7% IHSS restoration, and $380 million to provide at least 10% increase in developmental services funding. In the event of any excess, this bill ensures that all additional revenue generated is directed towards further Medi-Cal rate increases. We have known for more than a year that we have a problem with federal funding of Medi-Cal. Yet until AB 4 was introduced, there was not one bill proposing a fix to the current MCO tax that the federal government has said does not meet their guidelines. I chose to pursue the MCO flat tax because it meets the federal test and is more reliable than a tiered tax. The LAO recently issued a report confirming that a tiered tax is an unreliable revenue stream, that this is due to volatility in the marketplace as MCOs merge and as covered lives move from one MCO to another. However, AB 4 is not intended to be the only solution available. I recognize that there are political and policy challenges to this complicated issue, and the legislature exploring a variety of options, including a tobacco tax, a tax on sodas, and more. I am open to all of these options, but we need to move quickly in advancing this conversation. We need all options on the table, and we need to achieve this solution before the legislature adjourns. Sitting on the sidelines and hoping something comes together is a luxury that we cannot afford. We've got real lives at stake, and we have what it takes to resolve this issue before a session ends in 4 weeks.